Welcome to this presentation on congestive heart failure. This presentation will provide health promotion information regarding heart failure and ways to prevent repeated hospitalizations in African American women. What is heart failure? Heart failure is when the heart has to work too hard to pump blood through the body. As a result of this decrease in function, you will have a number of symptoms, including fluid retention, swelling in the lower legs, ankles, and/or feet, congestion, high blood pressure, fatigue, shortness of breath, weakness, and weight gain. African Americans are at an increased risk for developing heart failure, 50% more likely than Caucasians. Therefore, it's important for them to understand the disease and how to manage it. This empowering women to control their own health goals supports Goal 3 of the Millennium Goals. Learning needs assessment. Assessing the learning needs of this population will include identifying the average educational background of the population and identifying the learning styles that should be incorporated. Several learning styles will be incorporated into the presentation, including visual and auditory. One study, then the priority needs of this target population need to be addressed. And those priority needs are understanding the signs and symptoms of heart failure, diet and exercise, medication management, record keeping for weight, the importance of follow-up visits with health practitioner, and when to seek emergent medical attention. One study has shown how addressing these priority needs can decrease exacerbations and hospitalizations. The health promotion model that we used was the precede-proceed model. This model was chosen because it is designed to guide the planning and development of health education programs. Furthermore, this model provides a path for communities to participate in their own health promotion process. The acronym stands for Predisposition, Reinforcing, and Enabling Constructs for Educational, Ecological Diagnosis and Evaluation, and Policy, Regulatory, and Organizational Constructs in Educational and Environmental Development. The following steps are included in the Health Promotion Education Plan. Community assessment. Our assessment of the community includes learning needs and priority needs. Epidemiologic assessment. This assessment is to look at the prevalence of heart failure in the population. The behavioral environmental assessment. The behavioral assessment includes the community's commitment to carrying out the plan to meet healthcare needs. The educational assessment. The educational assessment will include what's the average educational background of the target community. Administration policy assessment. This assessment comes in evaluating the available resources to meet health goals. Implementation of interventions, process evaluation, and outcome evaluation will be necessary to determine whether or not the educational plan is successful. Health promotion and education plan. So the goal of this presentation is reduced frequency of hospitalization due to exacerbation of congestive heart failure in African American women in this community. The educational teaching plan will address each of the priority issues discussed earlier, and the 3 behavior outcomes of the teaching will include that participants will weigh themselves daily and report a change of 5 pounds a week to the healthcare provider. Participants will identify 3 foods to avoid as a part of a heart-healthy diet. Participants will take medications as prescribed by physicians. Evidence has shown that medication management, especially that of diuretics, and compliance with a heart-healthy diet can decrease CHF exacerbations in patients. The methods and tools we're going to use. We're going to utilize both visual and auditory information to these women, pamphlets, PowerPoint presentations, and discussion. We'll do more of a roundtable discussion as opposed to a nurse standing in front and just talking at the women. We want them to engage in conversation. And we'll also use the teach back method because this has shown to be an effective tool in decreasing readmission for heart failure exacerbations, according to one study. A variety of studies were utilized in providing information regarding heart failure to this population and health promoting ideas to apply to the educational plan. One study was related to the prevalence of heart failure in African Americans, and it gives a foundation for developing the education plan surrounding the priority needs of this population. One study outlined the priority educational needs of the patients with heart failure, which will be highlighted as part of patient teaching. Another study highlighted the teach back method as an effective tool to avoid readmission. And finally, one study showed the association between medication management and prevention of exacerbations of heart failure. Evaluation. The method we're going to use is outcome evaluation. This measures the outcomes that are related to the specific health promotion plan. And the tool we're going to use is self-evaluation. Patients will be asked to keep a wellness diary to track the progress of diet, exercise, weight, and symptoms over a predetermined period of time. In conclusion, moving forward for this community health, in this population, is to prevent hospitalization for CHF exacerbation. We're going to do that with continued education on heart failure and effective ways to manage it. We're going to reduce hospitalizations related to CHF in other populations. We're going to empower women to engage in the health promotion process. And we're also going to allow women to help themselves and each other in meeting their health goals. And this is my list of references used to provide some information for the PowerPoint. Thank you for listening.